Let's start with root canals. The reason a root canal started is good. If someone has a tooth that's dying, that tooth hurts. That toothache leads to want to have something done, and for centuries, the only option at that point was to pull the tooth out. Well, pulling teeth out actually is pretty hard. It's hard on the patient. It's not a very easy thing to do from a dental standpoint, and it hurts, right? Dentists figure out that there was a center nerve in the tooth that could be removed, cleaned out, and filled back in again, and the tooth wouldn't hurt anymore. This was a great thing. It was a great advent because dentists can now save teeth. This was good for patients. This was good for everyone. Unfortunately, that's not, again, the whole story. Well, when do you need a root canal? You need a root canal if the nerve inside that tooth has been infected or affected. And you usually know that because the tooth hurts. It's particularly sensitive to hot, cold, biting, or the tooth has already died and your face actually swells up. That's called an abscess. If that's happened, the nerve inside of that tooth is irreversibly damaged and either has to be removed or the tooth removed. And those are really the only two options we have right now, is that nerve is removed in the inside of the tooth and that inside of the tooth is filled up, called a root canal, or the entire tooth is removed. Why is there a problem with the root canal? It sounds great, right? There's many well-known problems that if you ask any dentist, they will tell you these. First of all, it's really hard to do a root canal perfectly. It's hard to clean all of the nerve tissue out. It's sometimes difficult to get bleeding stopped inside of that tooth. It's difficult to know, did I disinfect it long enough? You're supposed to leave the disinfectant in for up to 15 minutes. Well, rarely do we stop and just let something sit for 15 minutes when doing a dental procedure. It's difficult to know whether that root canal has been sealed properly. The seal on top of it has to be proper, so the crown or whatever's put on top of the tooth has to be sealed properly. There's so many things that could go wrong, so it's really nearly impossible to do it perfectly. And to do it perfectly every time, there's no way that's going to happen. So can you have a successful root canal? Well, let's first talk about why they're not successful at times. Remember that anatomy that we talked about? The center of the tooth has the nerve canal, and that's the main nerve of the tooth. But all of those nutrient channels that go through the dentin of the tooth, that mile of tubules in every molar, those nutrient channels also have nerve tissue in them. And there's no way that one little cleaner that goes through the center of the tooth is going to clean out all of those nutrient channels. The disinfectant that we put inside of the tooth is not going to clean out all those nutrient channels. So there's going to be dead tissue and perhaps bacteria inside of those areas that it's impossible to clean out. As long as your immune system stays strong, you're going to be able to keep those bacteria at bay and you're not going to have a problem. Now, my son Josh, when he was 11 years old, he got hit in the mouth with a baseball. It broke out his 3 front teeth. 2 of the teeth actually broke halfway down the roots. 1 of them came out, 1 of them stayed. Just well enough that we could do a root canal on it and keep it in his mouth for a little while. I chose to do a root canal on his tooth because he was 11 years old. You can't place dental implants until you're done growing, which is age 20 probably for a boy or perhaps even older. And he was missing his 3 front teeth. I needed something to anchor the other teeth on during his growing up years. So I did a root canal. Well, I know the end of the story now because my son is now 20 years old. That root canal has an enormous abscess on it and it's coming out immediately. His body was strong, he was young, he was healthy. I was able to keep track of him for most of his growing up years, and we were able to keep that healthy. It's no longer healthy. That's typically what I find, is that if you are within that 30% of people that have a healthy immune system, you don't have a family history of degenerative disease, you don't have any symptoms in this tooth, you don't have any other health issues, then you may be able to keep that tooth healthy for a while. And Dr. Weston Price was the one that actually started this. He found the exact same thing clear back in the 30s, that it is possible to keep a root canal tooth healthy for a little while if you have all of those things in your favor. Unfortunately, 70% of people don't have all those things in their favor. So what do you do if one fails? The first thing, and really the only thing that I recommend, is to remove the tooth. You have to remove that following proper tooth removal protocol, however. What that means is, again, back to that anatomy lesson. Remember that periodontal ligament that I talked about? That was the connecting ligament between the tooth and the bone that the tooth is sitting in. If the tooth is removed, that periodontal ligament doesn't naturally just come with the tooth. I tell people it's kind of like the placenta when a baby is born. It doesn't naturally just come at the same time. So that periodontal ligament has to be purposefully removed. If it's not removed, the body thinks that there's still a tooth there for about 2 weeks. During that 2 weeks' time, the gum tissue grows down into the space that the tooth was removed from, but the bone doesn't start to grow. After about 2 weeks, the body goes, oh, I guess the tooth's gone. I better start growing bone. But the space where the bone should grow is filled in with gum tissue at that point. So the bone doesn't have a lot of space to grow into. That periodontal ligament that was never removed actually dies, turns into what's called necrotic tissue. So now you have dead tissue surrounded by gum tissue, which is a breeding ground for bacteria. So we're going to talk in just a moment about what happens when wisdom teeth are removed improperly and how this leads to other problems down the road. So remember, if you're going to have this tooth removed, when you have a root canal fail, it has to be done properly. Make sure that you ask the dentist, what do you do to remove that periodontal ligament? You can also choose to have that root canal retreated. The reason I say that my really only option that I recommend is to have the tooth removed is because retreating a root canal that's already failed is kind of like saying, we're going to just try again on something that's already failed, but it's probably going to fail again, which it will do. And what we see is that retreated root canals have a much higher rate of failure than the first root canal. You also have the option to surgically retreat the root canal, which means they go through the gum above or below the tooth, cut off the end of the root, and seal it from the top down. Again, the incidence of failure rates on this kind of treatment is much higher than the original root canal. So if we're seeing that 70% of root canals fail, more than that are going to fail after they've been retreated or surgically treated. So in my opinion, I think it's better just to get the tooth removed and treat it properly and replace it so that you could have a tooth to then depend on for the rest of hopefully your life. There are some new options on the horizon. There's some new ways of doing root canals. There's some new ways of cleaning root canals, of disinfecting root canals, and I am hopeful that we're going to be able to utilize those sometime in the future. But right now we don't have those options.